Hi everyone, I'm Dr. Karam. I'm a board-certified facial plastic surgeon. I specialize in facial rejuvenation and really trying to help people look as young as they feel. Today we're going to talk about a really important topic, one that comes up a lot, and that is, are facelifts appropriate for people in their 40s? So the topics I want to talk about and kind of break down this important topic is we're going to talk about how the face ages, to put it in context. We also want to talk about non-surgical treatments, the pros and cons, and also we want to talk about what are the specific changes that would benefit from a surgical intervention, and then finally I want to talk to you about how I approach those changes with the surgical procedures that I do in my practice. So the first part of this discussion is, how does the face age? Now, regardless of where you are in the aging continuum, there's certain changes that are consistent across every age category. And those are basically, there's a change in the tone and texture of the skin loses collagen and elasticity. That affects the dullness and the fine lines and wrinkles of the skin. That has nothing to do with surgical correction. That's more about skin care and proper treatment for the actual skin. Then there's a change in volume. We start to lose facial fat as we age. We see this as loss in the temples, under the eyes, above the eyes. Our lips shrink a little bit, the cheeks get a little bit smaller. These are volumetric changes that happen because of fat loss. Then the third category is changes that are happening to the fascia of the face. The fascia is what basically causes the face to maintain a certain shape, and with age, that fascia begins to elongate and get a little bit distorted, and as a result we start to see squaring of the jawline, we start to see jowling, we start to see the changes of the mid-face coming down and deepening as in the nasolabial fold, and then finally heaviness in the neck region. Now those changes are what effectively would require surgical treatment, but those changes normally don't start happening until much later, usually at the end of the fourth decade, late 40s and early 50s. So now that we know generally what I would say typical aging looks like, it's something that starts, loss of volume, changes in the skin, and then finally culminizes into a change in the facial shape, normally by the time you're in your late 40s, early 50s. That's when most people come in for facial rejuvenation surgeries, get things like facelifts, etc. Now, there's a whole other category of people that start to lose that their facial shape and start to see signs of aging prematurely. Those are people that start to see laxity and jowling in their 30s and even early 40s. There's already laxity in the neck, laxity in the chin. These are the people that ultimately we are talking about in this particular video. What do we do with people who don't fit into the normal aging continuum? So let's dive into that for a moment. So if you're in your late 30s and early 40s and starting to see some of those changes we just talked about, laxity and looseness in the neck, etc., the typical approach that would be offered to you if you go into a medical spa, dermatology practice, and even in many plastic surgery offices, is you're going to be offered non-surgical treatments. Now, personally, after a decade and a half of treating patients in that age category with non-surgical treatments, I've come to the realization that those changes specifically do not respond well to non-surgical treatments. Things non-surgically, we're talking about the use of fillers, we're talking about lasers, we're talking about radiofrequency devices, all of which are designed to treat early laxity and to try to lift the face, etc. Problem with fillers are you start to put a bunch of fillers in the outer cheeks to try to lift the face up. We've kind of learned our lessons there, so those people end up looking unusual. They start to get really big. You get that pillow face, that chipmunk cheek, all those things that fundamentally change the way you look. Because remember, the core of this is we want to keep you looking youthful like you were before the changes happened, not like a different person. So fillers, when they're used for purposes of trying to lift, oftentimes lead to facial distortion. Things like radiofrequency devices, etc. What I've recognized, and I think the consensus is, is pretty in line with this, is that those things really don't fundamentally work. What we end up seeing is that you go through several of these treatments, and they're not cheap, and then ultimately, you continue to age through them. So they're not really slowing the aging process down, nor are they helping correct the aging problems. The next category, the very popular category, is thread lifts. We see a lot of these out there, and That's the idea of putting these dissolvable or non-dissolvable strings that have barbed attachments, and you lift up the face and it's supposed to hold things in place. Some of them are designed to increase collagen production, etc. But the net effect of those is that they're very short lasting, typically 6 months at the most. Even if you get a subtle change, you pretty much see the change give way by the time you're 6 months later. Plus they're relatively expensive. They cost between $3,000 to $6,000 to do. And if you think about how long you're going to be, if you're in your late 30s and early 40s and you're going to be doing these treatments that only last several months, I mean, it gets kind of frustrating and very, very expensive if you think about the aging continuum over a long period of time. So in a nutshell, a lot of those non-surgical treatments unfortunately don't work in correcting the problems that are related to laxity. They do work well correcting problems related to mild facial volume loss, like a little bit of filler here and there is all good, but not when it comes to laxity. So if you see jowling and laxity in your neck, you're probably not going to get much out of the non-surgical treatments, unfortunately. So, in brief summary of what are the changes that would lend themselves to effective surgical correction, those are, in a nutshell, you're going to see looseness and laxity of the outer fascia, the midface, jawline, and neck. And I want to emphasize that regardless of where you are in the age continuum, meaning if you happen to be prematurely aging, or if you're typical aging in your late 40s or early aging in your 30s and early 40s, the changes that would lend themselves to surgical correction are always the same. Those are the things that we're talking about. A fascia that starts up here, that comes down to here, all starts to loosen, and you begin to lose that youthful V-shaped jawline, that nice firm mid-face with the effaced nasolabial fold. The nasolabial folds get deeper with age, and then you start to see the hooding around the outer brow. Those are the changes that you want to target with a surgical correction. Okay, so now that we have thoroughly discussed, what changes lend themselves to a surgical correction, we've also talked about how people age. Now let's talk about how we can effectively deal with them. So in my practice, again, as I mentioned, I came through an evolution of trying non-surgical treatments, and I've now come to the conclusion that those changes that we just discussed really are effectively treated surgically, and it doesn't matter what age you are. If you have them, we need to fix them surgically in order to give you that youthful shape and that youthful sense. So the procedures that I have personally developed, for this particular type of problem is a procedure called the vertical prevent. If you are in your late 30s, early 40s, and you're starting to see just laxity in your jawline, laxity in your midface and the outer brow, the vertical prevent, it's a surgical procedure that's done under local anesthesia with IV sedation, will lift everything back up, and you can kind of experiment whether this would help you or not by simply putting your fingers out on your outer cheeks and your thumb right here on your jawline and lifting upward. This kind of upward motion like that will give you an idea of what that change would look like surgically. The beauty of the vertical prevent is that it's a vertically based procedure, so it gives you that natural look. It doesn't pull the face, it releases the facial tendons and ligaments so that everything is release and tension free. So not only does it look more relaxed and looks more natural, but also lasts very long. And that's really, at the end of the day, when you're in your early 40s or late 30s and you're starting to see these changes, you don't want to be back on an operating table 3, 4, 5 years from now. You want to give yourself 10, 15 plus years of freedom from having to see these aging changes happen. The next procedure that we have for that is if you start to see changes happening in the neck. Some people see fullness in here, some people see laxity. In those cases, I perform a technique called the vertical restore, which is basically a vertical prevent with the addition of a very directed approach to the neck, so we can get a really firm, sharp jawline and a smooth neck. And when you think about that, at the end of the day, the beauty of those procedures are that it liberates you from having to think and worry about how you're aging. Once it's done, it gives you long-lasting changes way beyond 10 or 15 years, because the way you're going to age will no longer follow the typical genetics that we see, in those premature early stages of aging, where things are kind of happening kind of quickly. And also for when people get into their late 40s and early 50s, when changes really start happening quickly, you're going to be guarded against that because of the changes that we make at the tissue level. So at the end of the day, The advantages are that of its long-lasting effect, its very natural-looking outcome, and the fact that it's done under IV sedation and local anesthesia. When you take all those things together, it's the right choice for those particular kind of changes. So I hope this that helped provide a sufficient overview and detail about how you should manage the aging process if you happen to be in your late 30s and early 40s and starting to see some of these changes. The idea of this is to help you stay efficient and effective, not waste money on treatments that aren't going to help you, that also have risks associated with them, but also give you a sense of hope that there is a procedure and a set of procedures out there that can really help you address these changes. More importantly, also, if you have friends that would find this information useful, please pass along. That's the whole purpose of these videos, is to educate and help people understand these confusing topics a little bit better. And ultimately, please like, comment, and subscribe to the channel for more videos like this and more content. Thanks so much.